Hello everyone, I'm Guoyue Lu from the General Surgery Center of the First Hospital of Jilin University in China.
Hello, I'm Zhongqi Fan in Professor Lu's team.
Today, we are so happy to share our story with you, titled From Clinical Variables to Multiomics Analysis, a margin morphology-based gross classification system for hepatocellular carcinoma stratification. Hepatocellular carcinoma is one of the leading causes of the cancer-related deaths. Many staging systems were proposed for HCC. However, distinct therapeutic strategies were usually recommended for patients with the same HCC burden. Actually, the accuracy of this staging system in guiding treatment decisions and predicting prognosis for solitary HCC remains limited. There is an old saying in pathological diagnosis that states microscopy accounts for 17%, macroscopy accounts for 30%. The liver cancer study groups of Japan classified HCC into these 5 gross subtypes based on the tumor shape. Gross classification has the potential to predict the prognosis of the patients undergoing hepatic resection for small solitary HCC. But it is not widely used clinical practice due to the limited number of the cases with each subtypes and undefined molecular mechanisms related with them.
In current study, we constructed a prospective cohort comprising 400 surgical patients with solitary HCC with 4 different gross subtypes. Our findings indicate that type 2 and 3 HCC have worse overall survival and recurrence-free survival than type 1, while type 4 HCC presented the worst prognosis. In addition, mRNA, lincRNA, and protein expression levels, as well as DNA mutation, were evaluated in both tumor and non-tumor samples. The 4 gross subtypes exhibit 3 different expression patterns. Type 4, not other 3 types HCC, displayed downregulated pathways, similar to those observed in intrahepatic cholangiocarcinoma. Histologically, type 4 HCCs showed a greater abundance of stroma than other subtypes. Next, type 4 was identified as an independent risk factor for HCC following hepatectomy. Type 4 showed increased angiogenesis and immune score. Patients with type 4 HCC were found to benefit from adjuvant TACE other than the other 3 subtypes. We additionally found that type 3 HCC can be further classified into 2 subtypes, type 3A and type 3B, which have distinct patterns of gene expression and differences in survival outcomes. Taking into account this finding, as well as the similarities observed between type 2 and type 3 HCC, we propose a modified and user-friendly gross classification system called MMC for HCC, based solely on margin morphology. The detailed classification method is shown on this slide.
In summary, our study reveals significant differences in molecular and pathological characteristics, as well as different response to different therapeutic strategies among 4 gross subtypes of HCC. An easy-to-use gross classification, MMC, was also identified. We believe gross classification may aid in the development of the precise individualized diagnosis and treatment strategies for HCC in the future. Meanwhile, MMC can improve the clinical applicability of gross classification for HCC.